Welcome, ladies and gentlemen, to this informative video presentation on the SPECT Scan. Today, we will explore the fascinating world of medical imaging and delve into the significance of SPECT Scan. My name is Ezra, and I am delighted to be your guide through this journey. SPECT Scan, also known as a single photon emission computed tomography, is a powerful diagnostic tool used in medical imaging. It provides valuable functional information about the brains or other organs. So, unlike traditional imaging techniques such as computed tomography and magnetic resonance imaging scans, which focused on structural details, SPECT scans go beyond anatomy and offer insights into the actual functioning of the target area. So, by using a small amount of radioactive material known as radiotracers, SPECT scans can visualize the distribution and activity of specific molecules in the body. So, these radiotracers emits gamma rays which are detected by a specialized camera systems. These rays generated data that is processed by a computer to create a detailed images revealing the functional processes occurring within the body. So, SPECT scans are particularly useful in assessing the blood flow, metabolism, and neurochemical activity in the brain. They aid in the diagnosis and monitoring of various conditions such as Alzheimer's disease, epilepsy, and psychiatric disorders and brain tumors. So, by providing functional information, SPECT scans can help healthcare professionals gain a deeper understanding of the underlying causes and effects of these conditions. So, in addition to brain imaging, SPECT scans can also be applied to other organs such as the heart, the liver, and the lungs. They allow medical professionals to assess the functioning and viability of these organs, aiding in the diagnosis and treatment of various diseases.
Single photon emission computed tomography, or also known as SPECT, is a medical imaging technique that is based on conventional nuclear medicine imaging and tomographic reconstruction methods. So, SPECT scan it provides detailed physiological information about the tissues. So, SPECT can differ from other medical imaging modalities. Example, radiography, computed tomography, and magnetic resonance are useful in imaging the anatomy, while the SPECT scan it provides physiological information about the tissues, and the radiation source is within instead outside the patient for clinical and diagnostic treatment purposes. At its most basic level, SPECT produces a three-dimensional image of distribution of a radioactive tracer, sometimes called a probe, injected into the bloodstream, subsequently taken up by the tissues. So this is accomplished via the use of specialized nuclear medicine cameras. The examination is accomplished via the production and administration of radioactive tracer compounds, also known as probes. So, these probes generally consist of a detectable radioactive isotope coupled with biologically active ligand specific to the tissue being imaged. So, the most common isotopes used are technetium-99, iodine 123, and to a lesser extent thallium-201. When selecting an isotope, clinician must consider the goal of scan, the risk to the patient, and the expense of the isotope itself. The technetium-99 has a half-life of 6 hours and high photon flux, so leading to a shorter scan times and lesser radiation exposure to the target organ. So this allows the administration of higher tracer doses, providing clear images without significantly increasing radiation exposure to the patient. So the iodine 123 has a much longer half-life of 13 hours, leading to a greater concentration of detectable iodine in the target organ compared to the background. However, the longer half-life and greater localized concentration of iodine 123 increase the risk of radiation to the organ. Because of the short scan time, clear images, and low associated radiation dose, technetium is often preferred isotope for the most clinical application. However, iodine isotopes are highly preferred for the studies of iodine-consuming tissues such as thyroid gland. Although the isotope chosen by the clinician is important, SPECT imaging depends on more than just the selection of the correct radioisotope. So the success of the SPECT scan requires an isotope to be successfully bound to a biologically active ligand which will interact with the body's tissues to deliver the isotope to the desired location. The nuclear camera, or otherwise known as a gamma camera, uses special imaging techniques called planar dynamic or single photon emission computed tomography (SPECT) to detect the radioactive energy that is emitted from the patient's body and convert it into an image. The gamma camera itself does not emit any radiation. It is composed of radiation detectors called the gamma camera heads, which are encased in metal and plastic and most often shaped like a box attached to a round circular donut-shaped gantry. The radioactive energy emitting from the patient body is the result of the introduction of radioactive material called a radiopharmaceutical or radiotracer into the body. As mentioned before, this material can be injected into the patient's bloodstream, or it can be either swallowed or inhaled as a gas. The material accumulates in the area of the body under examination, where it gives off a small amount of energy in the form of gamma rays. So during your scan, you lie on the table while the SPECT scan or the SPECT machine rotates around you. The SPECT machine takes pictures of your internal organs and other structures. The pictures are sent to a computer that uses the information to create 3D images of your body. The indications for SPECT imaging are the following. So, one is for evaluating patient with suspected dementia, localizing epileptic foci preoperatively. Third, diagnosing encephalitis, monitoring and assessing vascular spasm following subcarotenoid hemorrhage, mapping of brain perfusion during surgical interventions, detecting and evaluating cerebrovascular, predicting the prognosis of patient with cerebrovascular accident, corroborating the clinical impression of brain death. So in addition, the American Society of Nuclear Cardiology has developed an extensive list of indications for cardiac SPECT studies. So some notable indications include evaluating patients for coronary artery disease, assessing treatment, response, and guidance of future therapy in patients with coronary artery disease, cardiomyopathy, and heart failure, diagnosing coronary artery disease in patients unable to perform a standard exercise stress test, pre-surgical of patients with suspected or confirmed coronary artery disease. SPECT scans are also indicated for non-cardiac and non-neurological conditions such as osteomyelitis, spondylolysis, parathyroid disease, pulmonary embolism, and abscess localization. The patient preparation. So before SPECT scan, the female patient should inform the doctor if she is pregnant. So The patient should inform the doctor of all the medication and supplements patient are taking, and patients should be instructed to avoid caffeinated beverages for at least 12 hours before the study. This is because caffeine interferes with the action of vasodilatory medication that may be administered during the study. So caffeine also affects the cerebral blood flow, can negatively influence cerebral SPECT imaging. The patients should also avoid dipyridamole and other phosphodiesterase 3 inhibitors for at least 48 hours to avoid synergistic vasodilatory effect, which may produce an unsafe drop in blood pressure. Finally, all patients should be made meal per oral for at least 3 hours before procedure and asked to void urine beforehand to maximize comfort. Here are the most common types of SPECT scan. So these are the following, or these include the SPECT brain scan, the SPECT heart scan, and the SPECT bone scan. So depending on your situation, your provider may also do a regular SPECT scan or a SPECT CT scan. A SPECT CT scan combines two types of scan, single photon emission computed tomography and computed tomography. So let's talk about the SPECT brain scan. So a SPECT brain scan, it can detect altered blood flow in your brain. So it can tell your provider which areas of your brain are most active and least active. So SPECT brain scan helps to diagnose neurological conditions like seizure, stroke, Parkinson's disease, epilepsy, dementia, Alzheimer's disease, traumatic brain injuries. The next one is the SPECT heart scan. So this type of scan can show your provider how well your heart works. So it can help diagnose a wide range of conditions including scar tissue, which can indicate a heart attack, coronary artery disease or narrowed arteries, the arteriosclerosis, clogged arteries, and the poor circulation. So a SPECT heart scan can also tell your provider how well you recover after triple bypass surgery or other heart procedures. The last one is the SPECT bone scan. So a SPECT bone scan can find issues that other imaging tests can't detect, like stress fractures, the bone infections, bone cancer, or cancers that spread to your bone.
So, the advantage and limitation of the SPECT scan. So, the advantage of the SPECT scan is a type of nuclear imaging test, which means it uses a radioactive substance and a spatial camera to create 3D pictures. So, a SPECT scan is similar to an MRI study in that both show a 3D image of the brain. However, whereas MRI shows the physical anatomy and structures of the brain, what SPECT scan shows how the brain works. So next is while imaging tests such as x-rays can show what the structure inside your body look like, a SPECT scan produces images that show how your organs are functioning. For instance, a SPECT scan show how well your blood flow is flowing to your heart, what areas on your brain are more active or less active, or what part of your bone are affected by cancer. So next, So a SPECT test create a detailed 3D map of the blood flow activity in the brain, which can be helpful in determining which parts of the brain are being affected by. First is clogged blood vessels. So SPECT scanning can detect altered blood flow in the brain and help diagnose or evaluate certain vascular brain disorder such as myoiditis. So this condition which the arteries in the brain become blocked or narrowed. So this is the picture. Next is the seizure disorders. A SPECT scan can help diagnose and treat seizures disorder, so such as epilepsy, by pinpointing the area of seizure activity of the brain. Next is the Parkinson's disease. So in rare cases, the doctor may suggest a specific SPECT scan called a dopamine transporter scan or the T-scan. So this is the image of the T-scan. So the T-scan help to confirm a diagnosis of Parkinson's disease, a progressive neurologic disorder that affects the movement. Next is the limitation of the SPECT scan. So the limitation of SPECT scan have the radiation exposure, limited spatial and temporal resolution, the relatively expensive to build and maintain compared to MRI, and the artifacts. So SPECT scan artifacts. SPECT scan artifacts are common sources of error in single photon emission, computed tomography, and positron emission tomography imaging, and can lead to false positive results, decreasing the accuracy of the study and increasing the rates of unnecessary referrer to coronary angiography. So we have types of artifacts. First is the patient-related artifacts, and second is the instrumentation-related artifacts. Okay. So the patient-related artifacts. So under the patient-related artifacts, we have the attenuation. So attenuation is a suspect. Attenuation is a suspect when the defect is location is known to be influenced by the soft tissues. And next is the breeding. The breeding is a misregistration or blurry image of the film. So next is the motion. So motion is a blurry images, opposite wall of defects, and abnormal LV cavity shape motion on dynamic range images. Next is the GI activity. GI activity is a review of images for some diaphragmatic activities, check contours and alignment. And last is the physiologic artifacts, which may see to a persistent blood flow artifacts. Next is the second artifacts is the instrumentation related artifacts. So under instrumentation related artifacts, we have three artifacts. First is the center of rotation artifact. So center of rotation artifact is critically important, and cameras should be checked weekly for correct center of rotation alignment. So this center of rotation artifact, this allows for data from SPECT images that are processed with filtered black projection to be aligned correctly, and an error in the center of rotation by just a few pixels can result in blurring of images and produce an artifactual defects on SPECT images. Next is the camera head misalignment. So if the camera heads are misaligned, this can stimulate center of rotation artifacts. So misaligned images can cause artifactual images defects. These defects will be more pronounced with three-headed speed camera. So the last is non-uniformity. So these artifacts are present imaging. This artifact is present imaging should not be performed on the camera until uniformity is corrected. Next is how medical professionals interpret and analyze the results of a SPECT scan. So a SPECT scan is a nuclear imaging scan that integrates computed tomography and a radioactive tracer. So the tracer is what allows doctor to see how blood flows to tissues and organs. So tracer is injected into your blood streams. The tracer is radio-labeled, meaning it emits gamma rays that can be detected by the CT scanner. So the computer collects the information emitted by the gamma rays and displayed it in the CT cross-section. So there are cross-section can be added back together to form a 3D image of your brain. So a radiologist or a doctor with advanced training in nuclear medicine will analyze the results of the SPECT scan and send them to the doctor. Pictures from scan may show doctors that tell the doctor what areas of the body absorb more of the radioactive tracer and which area absorb less. So, for instance, a brain SPECT image might show a light color where brain cells are less active and darker colors are where brain cells are more active. Some SPECT images show shades of gray rather than colors. Next is we have abnormalities observed on SPECT scan. So in cross-sectional studies, the abnormalities seen in SPECT were most frequently seen in two brain regions, the frontal lobes, which is 94%, and the temporal lobes, which is 77%. So these findings show that SPECT scan can be useful in many areas of the clinical process, varying degrees of head trauma. So the functional brain imaging tool aids in making a diagnosis, determining the patient prognosis, and developing an effective treatment plan in brain trauma survivors. In complex psychiatric cases, SPECT may also detect abnormalities associated with brain injuries even when the patient has no recollection of suffering a head trauma. Next is, we have two types of brain SPECT scan. First is the surface SPECT scan and second is the active SPECT scan. First, we have surface SPECT scan. Surface scan. So, a healthy surface scan looking down on top shows full, even, symmetrical activity. So, here's the picture. So, surface scan is help us to see areas that are healthy and those with low activity. So, the first picture shows us this underside, and the second picture shows healthy SPECT surface right side. Next is the healthy active scan shows the most active parts of the brain. So here is the blue. The blue is the average activity, while the red, or sometimes red and white, are the most active parts of the brain. In healthy scan, the most active area in the brain is the cerebellum. So at the back or bottom part of the brain makes up just 10% of the brain's volume, but houses half of the brain neurons. So here is the healthy speaks active underside, and this second picture is the healthy speaks active right side.
Room design and dimension of SPECT. So the design and dimension of a SPECT room should adhere to certain guidelines to ensure patient safety and optimal imaging conditions. So the key considerations includes shielding, layout, access, lighting, HVAC, electrical requirement, and safety equipment. So the first key components or considerations is shielding. The room should have adequate shielding to minimize radiation exposure to staff and the surrounding environment. So, typically, lead or concrete walls, floors, and ceilings are used to prevent sufficient radiation protection. Layout. The room should be spacious enough to accommodate the SPECT equipment, patient bed, or chair, and any necessary supporting equipment. Sufficient space should be provided to allow healthcare professionals to move around comfortably. Access. So the room should have appropriate access points for patients, staffs, and equipment transfer. It should also have a dedicated control area for the technologists to operate the scanner safely. Lighting. So the room should have an adjustable lighting to facilitate image acquisition and patient comfort. So, dimmable lights are often used to minimize the patient's anxiety. HVAC. So, adequate ventilation and air conditioning should be in place to maintain a comfortable environment and ensure proper air circulation. Electrical requirement. The room should have appropriate electrical outlets to power the SPECT equipment and other necessary devices. Safety equipment. So, fire extinguisher, emergency alarms, and radiation monitoring devices should be readily available. So, next is disposal of radioactive materials. So, the disposal of radioactive materials from SPECT scan should comply with local regulation and guidelines. So, typically, the following steps are involved. The first is segregation. Next is storage, decay, authorized disposal, and record keeping. So segregation is when radioactive waste should be segregated from other waste stream to prevent contamination. Storage. So radioactive waste should be stored in designated containers that are shielded and clearly labeled as radioactive. Decay. So, depending on the half-life of the radioisotope used, the waste may need to be stored for a specific period to allow the radioactive to decay. Authorized disposal. Radioactive waste should be disposed of through authorized channels such as licensed waste management facilities or under the supervision of a trained personnel. Record keeping. Proper documentation of waste generation, storage, and disposal should be maintained for regulatory compliances.
Certainly, SPECT can have several applications in clinical practice, demonstrating their utility and impact. Here are a few examples. Cardiac imaging. SPECT scans are frequently used in cardiology to assist blood flow to the heart muscle. This can help to diagnose coronary artery disease by revealing area with reduced blood supply. This information guides treatment decisions such as angioplasty or bypass surgery. Next is Neurological disorders. In neurology, SPECT scans aid in evaluating cerebral blood flow. They have proven variable in diagnostic conditions like Alzheimer's disease, epilepsy, and assessing the extent of the brain injury after a stroke. This information contributes to the treatment planning and prognosis. Next is oncology. SPECT imaging is employed in oncology for tumor detection and characterization. It can provide insight in the blood flow within tumors, helping oncologists determine the stage of cancer and plan appropriate intervention such as surgery, radiation therapy, or chemotherapy. Bone scintigraphy. SPECT scans are utilized for bone imaging, particularly in detecting metastatic bone disease. They help to identify area of abnormal bone metabolism, assisting oncologists in staging cancer and planning target treatment strategies. Psychiatric disorders. SPECT can play a role in psychiatry, assisting cerebral perfusion and activity. In conditions like depression, bipolar disorder, or schizophrenia, SPECT imaging may contribute to understanding brain function abnormalities, aiding treatment selection and monitoring. Infectious and inflammatory diseases. SPECT scan can be beneficial in detecting area of infection or inflammation. For example, in orthopedics, they help to identify site of osteomyelitis, guiding appropriate treatment and approaches. These examples highlight the versatility of SPECT scan across the various medical specialties, providing a variable information for accurate diagnosis, treatment planning, and monitoring patient outcomes. Single photo emission computed tomography, or SPECT, and computed tomography, CT, use ionizing radiation, and therefore, when this examination are used, the ALARA principle, radiation dose as low as reasonably achievable, must be observed. Even though there is no legal limitation to radiation dose given to the diagnostic or therapeutic purposes, one should try to minimize patient radiation exposure in SPECT and CT. A guideline to improve the management of the patient dose in medical imaging is the DRL, Diagnostic Reference Level concept. Doses of SPECT examination are typically much lower because of the technetium 99, the most widely used radioisotope in SPECT imaging, exclusively emits gamma rays. It is state-of-the-art to use short EO and fewer gamma emitters. This is different when other isotopes with much longer effective half-lives and or additional beta- ray emits are used.
These are the key terms highlighted. Number 1 is the SPECT scan. SPECT stands for Single Photon Emission Computed Tomography. It is a powerful diagnostic tool, functional information, radio tracer, gamma rays, specialized camera system, blood flow, metabolism, and neurochemical activity. Number 2 is the radioactive material, radio tracer, the distribution and activity visualization, and gamma rays emission. Number 3 is the isotopes, technetium, iodine, and thallium. Number 4 is the nuclear camera, gamma camera, planar dynamic imaging, SPECT, radioactive energy detection, gamma camera heads, 3D images creation. And number 5 is the indication for SPECT imaging, dementia, epileptic foci localization, encephalitis diagnosis, monitoring vascular spasm post, subarachnoid hemorrhage, brain perfusion mapping during surgery, cerebrovascular disease detection. And the prognosis prediction for cerebrovascular accidents, cardiac indications, coronary artery disease and treatment response, non-cardiac and non-neurological conditions, osteomyelitis, and pulmonary embolism. Number 6 is the patient preparation, pregnancy notification, medication disclosure, caffeine avoidance, meal per oral for at least 3 hours, void urine beforehand. Number 7 is the types of SPECT scans. SPECT brain scan, SPECT heart scan, SPECT bone scan, SPECT or CT scan. Advantages of SPECT scan: nuclear imaging test, 3D image reconstruction, physiological information, blood flow assessment, organ functioning visualization. Number 9 is the abnormalities detected by SPECT: frontal lobes and temporal lobes involvement, diagnosis aid for brain trauma survivors, complex psychiatric cases assessment. Number 10 is the SPECT scan artifacts: attenuation, breathing artifacts, motion artifacts, GI activity, center of rotation artifacts, camera head misalignment, and non-uniformity. Number 11 is the medical professional's role: nuclear imaging scan integration with CT, radiologist or nuclear medicine specialist, analysis, result interpretation, images showing radioactive tracer absorption. Number 12 is the application of SPECT in clinical practice: cardiac imaging, coronary artery disease, neurological disorders, diagnosis, Alzheimer's and epilepsy, oncology applications, tumor detection and staging, bone scintigraphy, metastatic bone disease, psychiatric disorders assessment, and infectious and inflammatory diseases detection. Number 13 is the alarm principle: as low as reasonably achievable, minimize radiation exposure. In conclusion, single photon emission computed tomography SPECT stands out as a powerful diagnostic tool, providing detailed functional insights into organs and tissues. Its unique ability to visualize physiological processes, coupled with careful patient preparation and adherence to safety principles, positions SPECT as an indispensable asset in diverse medical specialties. Despite challenges like artifacts, SPECT's impact on precise diagnosis and treatment planning is significant, showcasing its ongoing relevance and potential for advancing